With the new HIV prevention pill called PrEP, you can be free to be spontaneous, be bold, be you. So when the mood strikes, you will be ready because you will be safe. What is PrEP? PrEP stands for pre-exposure prophylaxis. It is a medicine that can prevent HIV from taking hold in your body. Using PrEP can lower your chances of getting HIV from sex by over 90% and from shedding needles by more than 70%. PrEP stops HIV from taking hold and spreading throughout your body, but it's really important to use PrEP correctly, meaning on time, every time. PrEP doesn't work as well if you skip pills or miss your shot appointments. If you don't take PrEP on schedule, there might not be enough medicine in your body to block HIV. PrEP also doesn't prevent other sexual transmitted infections like gonorrhea and chlamydia. So use condoms along with PrEP to help you avoid STDs and have you add in layer of protection from HIV. Is PrEP safe? It is very safe. Most people who take PrEP don't feel side effects. If they do, they happen. They're usually mild and resolve within the first 1 to 3 months. The most common short-term symptoms for PrEP include diarrhea, nausea, vomiting, and loss of appetite. Long-term side effects are very rare, but may happen and mostly relate to kidney health and slight weight loss. If your kidney lab levels decline, you may be able to switch to a different PrEP formulation. There is one more side effect from PrEP that's not often mentioned. It is some people end up feeling less anxious about HIV. You may find that PrEP gives you mental and emotional space to become more proactive around your sexual health. Is PrEP for me? Anyone can use PrEP to prevent HIV infection. If condoms aren't or cannot be used during sex, or if using clean syringes is not possible, then taking PrEP is an effective way to prevent HIV. PrEP doesn't prevent other sexually transmitted infections or pregnancy. PrEP can give you more control over staying HIV negative. It can heighten partner intimacy, sexual and romantic satisfaction, and peace of mind, and may also help you build a closer relationship with your doctor. Um, if you're not sure that PrEP is for you, you can try it out for a short time. If you like it, great. If you decide it's not right fit for you, you can safely stop with the guidance from your doctor. How often should you take PrEP? PrEP can be pill or shots. Taking PrEP once a day is the preferred method. Talk with your doctor about how long you need to take PrEP before you're fully protected. Daily PrEP is the only effective method for women, but if you're a man, you can also take PrEP on demand, meaning you take two pills at least 2 hours before sex, then you take one pill once a day for 2 days after you had sex. Tell to your doctor if you want to switch from PrEP pills to shots. How can I start PrEP? Um, Tell to your doctor if you think PrEP may be right for you. PrEP can be prescribed by any healthcare provider who is licensed to write prescriptions. Before beginning PrEP, you must take an HIV test to make sure you don't have HIV. While taking PrEP, you'll have to visit your doctor routinely for follow up visits, HIV tests, and refills. Telehealth services can also be an option. How much PrEP costs? It's very affordable, and everyone interested in PrEP should be able to get it. It is covered by Medicaid and most healthcare insurance plans, and without co-pays or cost sharing. But if you don't have health insurance or Medicaid coverage, there are other programs that provide PrEP for free or at reduced cost. So, what else should you know about being on PrEP? Once you're on PrEP, you'll need to get tested every 2 to 3 months for HIV. Your doctor will talk to you about any side effects or symptoms that you might be having. They may also test you for other STDs, and they test you to make sure your kidneys are working well. So it is really important to go to these follow-up appointments to make sure you stay healthy and HIV free. It is really unlikely that you will get HIV when you're using PrEP consistently, but if you do happen to get HIV while using PrEP, it is important for your doctor to stop using PrEP right away. PrEP is not a treatment for HIV. In fact, taking PrEP when you have HIV can actually make a virus harder to treat.